G'day everyone, it's Andrew Whitehouse here, and this week we're talking about COVID. Now, I really hesitated as to whether I should talk about COVID because we're all sick to our eyeballs about it, but I saw this study and I thought it was actually quite important to convey the messages. The study we looked at this week is a study that looked at the impact of COVID on social isolation for adults on the autism spectrum. Now, what this study did is it's an Australian study, and it provided interviews with 144 adults on the autism spectrum or caregivers of children and adolescents on the autism spectrum. And the findings they report are quite sobering. And what they found is that the social isolation associated with COVID actually significantly increased mental health difficulties amongst adults on the autism spectrum. Particularly, the adults spoke of the increased effects of the social isolation on their mental health. The decrease in that incidental social face-to-face contact also led to increased mental health difficulties, but they also spoke of the poor substitute of telehealth and digital health services when it's replacing face-to-face, person-to-person contact. So these findings are really sobering, but what they do actually indicate is that we do have a growing mental health challenge around COVID, particularly for the autistic adult population. It shows that social contact is as important for adults on the autism spectrum as the rest of humanity, and it's really important that we monitor, provide support, and keep this in mind as we move forward through the next couple of years.